So we are very thankful to Senator Roger Marshall and Senator Elizabeth Warren for their support. We really do need this on a congressional level, and looking forward to sharing the rest of the session today with you guys. I just wanted to emphasize that in this country where we don't have any form of universal access or even affordable access, we only have one form of guaranteed healthcare, which is the Emergency Medicine and Treatment and Labor Act. And physicians may be familiar with this as an unfunded mandate, which essentially says that patients, regardless of their ability to pay, are entitled to a medical screening exam and emergency treatment and stabilization. It doesn't guarantee that you're going to be seen by an emergency physician who's board certified and spent years in medical school and residency training in this. It doesn't guarantee that patients aren't going to be bankrupted after their visit. This is something that we have seen with large private equity firms getting involved in owning physician groups and weaponizing surprise out-of-network billing, which has really reflected poorly upon bedside emergency physicians, as it looks like it's our billing and our greed that has gone after patients when we actually have no control over the billing and are not privy to what's billed or collected in our names. So in reality, when physicians are silenced, especially in the emergency department, where we see society's most vulnerable, and we see them at their most vulnerable moments, including people who usually aren't vulnerable, then this becomes a public health threat. And this is reaching an extreme, has been going on for decades, but reaching an extreme during COVID. And so with that, I wanted to introduce Dr. Ming Lin, who you may know as an emergency physician who was at Peace Health hospital system, which subcontracted their emergency staffing to Team Health, which is a private equity owned by Blackstone staffing firm, which is prohibited in most states by corporate practice of medicine laws, but they are not enforced. And there have been physicians who have lent their name to skirt corporate practice of medicine laws. These groups don't provide due process rights to physicians, and hospitals often contract with them in ways that prevent these due process rights that physicians should have for patient protection. So I'm going to add Dr. Ming Lin to tell his story right ahead of Dr. Wendy Dean's keynote speech. Thank you, Dr. Lin.
Thanks, Mitch. If you can make sure I can share my slides, that'd be great. Anyway, this is a dedication to not just there's a lot of Dr. Lins out there. A lot of people have spoken about safety and being terminated. So this is my dedication to them. All right, my name is Dr. Ming Lin. I've been an emergency physician for over 30 years. In the last 20 years, I've resided up in Bellingham, Washington, which is located just north of Seattle, about an hour. And it's a unique place for me because it's the mountains and water within an hour away. It's a playground for outdoor enthusiasts like myself. Unfortunately, because of geography and the Canadian border, the area is monopolized by one hospital and its corporate medical groups. As you recall, Washington State was also one of the epicenters, or the epicenters of COVID-19 epidemic. We had the first case of COVID in this country in Seattle, and that was only about an hour away south of us. Just when COVID was blooming in Washington, I had been scheduled to do my first assignment with the Rosebud Reservation, home of the Sikangu Lakota tribe. The Lakota is who you think about when you think about Sitting Bull, when you think about Custer's Last Stand, when you think about hunting buffaloes. These were the Lakotas. In fact, the word teepee comes from the Lakota word home. The reservation is about the size of Delaware with about 10,000 people. However, it has the highest poverty rate in this country, percent below poverty. A third of these people lack one of the basic utilities. At the time, South Dakota had with 42 deaths. There was an outbreak at Evergreen Nursing Home. Then we heard about the young ER doctor in Seattle who was on the breathing machine fighting for his life. It was quite a nerve-wracking experience for most of us working in Bellingham. What I saw on my first day of work in Rosebud Hospital was eye-opening. The remote hospital, 3 hours from an airport, was preparing to battle COVID in a way that my hospital back home was not. In fact, it was business as usual in my home ED in Bellingham. Rosebud was doing temperature checks. They were asking people to wear masks. They were doing some kind of ventilated triage area. They were allowing their workers to dress up whatever they needed to prevent infection from spreading to their family and to the community. They even used duct tapes to wall off rooms. Now you're talking about a hospital that sometimes doesn't have urinals. We don't have bed sheets. We don't have pillows. This hospital was doing everything it can, no matter how scary it looked, to protect its staff and community. Well, I went home after my first shift and I was irate. I was angry. Actually, I was quite livid. I couldn't quite understand why my hospital in Bellingham could not implement just some simple measures like Rosebud did to protect its staff and patients. That night, I started posting on Facebook. I sent a copy to the hospital administrator, my director, and my colleagues. About a little week later, I was about to prepare to go to work in Bellingham, and I got this text message from an administrator telling me my shift had been covered. What really surprised me was the outrage from the community and from the nation. We had people protesting in front of the hospital. We had people putting posters in front of their car. News and media from all over the world contacted me. There was CNN, New York Times, LA Times, you name it. They all were there. It was also a very confusing and emotional time for me. I had hundreds of thoughts in my mind. Dozens and dozens of media companies contacted me simultaneously. I was fortunate there was a lockdown. I could do all my interviews through the computer in my underwear. I also attracted the attention of lots of lawyers. The ACLU contacted me with the law group they worked with. For me, it was an obvious choice. This was about healthcare workers' right to speak out and about safety. Healthcare workers' right to speak out about safety and not to be retaliated against when you do so. Now, unfortunately, 3 years into the lawsuit, my lawyers abruptly decided we need to settle that it was not a good financial decision to go to trial. A trial date had already been set. It was settlement or they were withdrawing. Now, I'm okay with the settlement, but there has to be acknowledgement of wrongdoing, like an apology. They said, no way, this would never happen, and my lawyers withdrew. Now, why continue with this lawsuit? First, we have to acknowledge that there's a real problem here, and it's a growing threat. The root of the problem is corporate healthcare system that prioritize profits over patient safety. We've seen this with drug companies. We've seen it with tobacco companies. My case is emblematic of the danger of corporate healthcare. I asked for measures to protect ourselves and our patients. The corporation saw it as something that scared customers away. But the main reason I'm continuing this lawsuit is this. This is a photo of the Christmas party we had years ago. During the beginning of the pandemic, corporate hospitals didn't practice just poor judgment and miscalculation. They intentionally put healthcare workers and patients at risk for the sake of profit. This isn't just about greed. This is criminal. It's important that we continue to fight because we will never have more attention to such an important issue than we do now. I have lost sleep, ponder every day about my decision not to settle. Lawsuits are a lot of stress, physically, mentally, and financially. I question myself all the time if this is the right thing for my family and me. It's fighting two big corporations, including a mega private equity company like Blackstone, too much for one person. But this lawsuit isn't about me. It's about the growing challenges of future generations of healthcare workers and what they will face. My daughter asked me the other day, and she told me the other day, you know, I'm thinking about becoming a doctor or ER doctor. And I thought, how could I possibly turn away, at least try not to make a difference and try to make things better for healthcare and for our patients?